Thank you.
Good evening. As the slides come, first I would like to earlier a speaker from West Africa had indicated that one of the programs was uncomfortable about the support made available to them, and they thought it was so small. I would like really to apologize on behalf of my colleagues who manage programs in countries. We strongly value partnerships. We know the power of Rotary. Beyond money, they bring network, influence, community, and these words have been really sounding very strong here today. In Uganda, we actually used the influence of Rotary even to form our End Malaria Council. They managed, Governor Ken, he was here earlier. We worked with him so many, oh, he's behind there. We worked so many years ago to get into the private sector and create a fund beyond what Rotary is doing directly. So with that, we really appreciate. I've been requested to speak about governance and strategic communication. Throughout today, I kept listening to keywords: community, partnerships, adopting, alignment, efficiency, evidence, data use. And as that kept going on, I wondered what else I will have to really speak about. But why I was requested to do this specifically, during COVID time, health system resources were highly strained. And especially in Africa, there was a tendency to shift the entire healthcare system to control COVID. And immediately we knew that essential services were suffering, including malaria. By then we were set to do a mass distribution of mosquito nets. We were set to do residual indoor spraying. And with lockdowns, all this could not be done. And no one could see the point. And I decided to do a solo risky campaign. And I recorded videos that why survive COVID and die of malaria? The end result will be the same. And in any case, there could be more death as we, does not mean we should not care about COVID. We also recorded some videos saying mosquitoes are not also in a lockdown. They're up and about. You know? And this caught attention, and soon the cause for maintaining essential services grew. The need for adaptation within the context of COVID to keep running these services in a smart way grew, and we managed to influence this really more broadly. Fast forward, I got contacted by people in Harvard that we should write a paper on strategic communication for malaria governance. And of course, I know Palman had a look at it and requested that we speak about it. I thought it is really about that, building a chorus of voices. A chorus is not really one voice. It's voices from all corners, but in symphony, demanding that action needs to be taken, but also getting involved, just not mere voices. And the point is, who leads this orchestra? Using which frameworks? Using which forum? And to achieve what? Here, it has been very exciting. We are talking about eradication, just not even malaria elimination, not even malaria. And I can see Rotary has taken the bar a little bit higher. The second thing, most meetings I attended focused on the scientific work, to a small extent, the health system. Here we are talking about communities, last mile, people-centeredness, sustainability. So the bar has been moved to another level of what is expected of governance. Now, this is in Yaoundé. Last year, a meeting was called to re-energize the action of high burden to high impact ministers of health, and they signed to ending especially malaria deaths. I thought I should talk very briefly about Uganda. That's what we are working towards. And we had set by this year to have reduced malaria infections by 50% of 2019 levels, and to have reduced malaria deaths by 3/4, because the tools exist, we are well supported. There was no reason not to achieve that. And this is how we moved. In terms of incidents, by now we're supposed to have been at 216 cases per 1,000. Unfortunately, we are not there. So the green line is how we should have moved according to our strategic plan, and the bars are where we are. Generally, we managed to reduce incidents by 11%. Deaths is the lower bars. We have managed to reduce deaths by about 40%. That's about 60% of our target. With the effort of everybody, we have really driven prevalence down from up to 42% in 2009 to a single digit by 2018, 2019. So there is a lot of progress, and this should be able to encourage us that the end game is possible. The actions and the interventions have been talked about a lot, so I can skip it. The partners also have been talked about a lot, but in terms of governance, we need to look at them. They are at all levels, from community, national, international. They involve international organizations, funding organizations, research organizations, as national programs, having different interests, different levels of power, and so agreeing on the outcomes of policy, of governance in terms of like policy, what is funded, which technology is chosen, how it is applied, needs a lot of communication and engagement, and potential conflict as well. And so in my position, we are between the community and other actors. Now we are finding a partner interested in the communities. And we are happy really to partner even more strongly with Rotary, so that we speak together for the communities, because their level of voices they don't get here. So we are the ones to amplify their voices. And I think I've talked about this a bit. Really, what are the structures? I think the biggest structure we know is the Malaria Policy Advisory Committee initially, now Malaria Policy Advisory Group for more participation. But also big funding organizations all have their strategies which influence what technology. So many new technologies have been talked about here. But you know the level of clearance needed for them to see the day of the light. It can be a very effective technology, but there are a lot of regulatory impediments which sometimes are utilized to hold back deploying effective interventions and driving them to scale, even getting them financing. Very hard decisions. Even if you have done cost-effectiveness studies, sometimes it becomes more of a political discussion. So how do we maneuver this? The goal setting, handling of the different actors. In all this, we really aim to achieve the well-known 5 C's. Commitment, cooperation. Some are missing here, continuity, because we are in for a long haul in this. So how do we keep sustaining long-term commitment? It requires a lot of engagement, a lot of communication. How do we have collaboration? It is a constant game, and in my position, really it takes the core of what we do. So it sounds so serious when one program receives a partner and says, this is so small money. Because that could be a test bait for you to check your seriousness. How do you close the door? I think I've talked about this. Really, we are about maintaining international support, financing, data use in the engagement, so that the engagement is driven really by evidence. But country ownership, I put it in between. Country ownership. Community engagement has been talked about here a lot. Multi-sectoral participation. But technology, which technology? I saw videos today which really brought up this, but the problem is normalization of malaria. We have talked a lot about the programs being very adaptive, but to be adaptive, there is leadership required. And I'm looking at leadership in the context of persuasive selling, because people resist change, but this is a very dynamic space, very ambiguous space, ever evolving space. And I thought we are really working towards building a collective sense of purpose, but also urgency. And it is for today. And this requires stronger and smarter communication, bringing malaria as a priority issue. Earlier, my predecessor had said they brought up that $5 billion is needed. And then I told, what about others? So where can we position the space for malaria in the bigger scheme of things? And Most importantly, I have 1 minute, we need to define the audience right. Also the message, how to get to the audience, who is the best messenger. Like the kids who made a video here, it makes it palpable, makes it real, because they have lived, they are talking about experiences. So the messenger is key, but also timing. Whoever played that video really timed it well, because this is a very right audience. Hope it could get a place in the bigger Rotary meeting, even few minutes. So timing. So you talked a lot about advocacy. In my article, I talked a lot about the issue of timing. Sometimes we are not the best messengers. Because we are facing the following things: competing health issues, other issues like when they emerge, disputes about priorities and approaches. So malaria won't become really a hot topic overnight. It needs deliberate advocacy and communication. We need a message from really diverse voices. You can see in this picture the CEO of the Global Fund visited us in Uganda on a World Malaria Day and was there with my minister, also the Deputy Speaker of Parliament, religious leaders, traditional leaders. So you need a diverse group. We put a lot of effort to get him visit so that he makes some point, even to our president, about the need for some action to be done. It was a very deliberate effort to get him in. So we need, making it a priority has to be an investment. And I saw Rotary talked a lot about engagement and advocacy. And it is part of, I think, priority, which most other people are not funding, so that we can amplify and multiply our efforts. Really, all what I've been saying is that the vision has to be clear, we need to be coordinated, and we need to ensure accountability for our actions between ourselves. We need to be aware that is a human relations issue and interests, and how do we balance it? We need building a lot of trust, and malaria messaging must balance urgency with possibility, because you promise, you have to come back to demonstrate results. And communication is very important as a tool of advocacy and influence. Thank you very much. Just in the picture, myself, we are launching the malaria vaccine, and also delivering later important interventions like seasonal chemo prevention, and the Deputy Speaker of Parliament, again with children there, on malaria work, all doing this communication and high profiling malaria. Thank you very much.